Welcome to the Dental Handoff. This is Dr. Kelly Tanner, and this is another episode of Dental Insights with my BFF, Erika Flateau. Hey, Erika.
Hi, Kelly. So great to be here with you today.
So mine and our episodes between me and Erika have gotten a lot of views. And so we thought that we would continue the conversation around the things that are interesting to you. That's why it's called Dental Insights. And Erika and I were just riffing about what it's like for an office when a coach comes in or a consultant comes in. Like Erika consults practices, I consult practices for hygiene and team and all of the above. Erika, what is your experience when you go into an office? How does the hygienist feel?
There's a variety of reactions. Some are excited and some are intimidated and nervous and worried. And I completely understand that because when about 10 years ago, my boss decided to bring in a coach. And I thought, well, I'm doing a good job. I just got a raise. All my patients love me. I took it personally and I made it about me, that it was a reflection on that there was something lacking. And that's why she brought in a coach. And now I understand that she saw me as a great bet, a good investment, and that I was worth it. And Rhonda Mullins of Atlanta, Georgia came in and she was a pistol and she rocked my world. And I was so out of my comfort zone. She pushed and pushed. And Rhonda, we actually lost her to cancer a few years ago. And I wish so much that I could tell her today about the impact that she had and the way that she changed my life. But she got a lot of resistance from me at first, and it was basically because I was afraid. And working through it and working with her over a year or two was the mentorship that I gained was something that I am absolutely so grateful for.
I think my experience is that some hygienists think that I'm coming in, or the office members think I'm coming in because the doctor's interested in making more money.
Mm-hmm.
Because, right? And
Right.
I just thought you wanted to make this all about the money and money to get from the patients. And I said, I wouldn't be here if that was the case, because the truth is if you are doing what's right by the patients, you're going to be co-diagnosing with the doctor to find it like the way that it is, to talk to the patient about it and giving them that autonomy to make decisions for themselves.
Mm-hmm. Absolutely.
And then of course they're going to come back for treatment. I mean, but that's why you're there, to tell them what you're finding.
Right. And one of the biggest things that we're experiencing as hygienists in our industry is just we're burnt out. Our days are feeling like the same thing hour after hour, like Groundhog Day. And where's my spark? Where's my fire? How do I get that back? And a coach coming in, and yeah, there's the push out of the comfort zone a little bit, but it makes us better practitioners. It makes us more expert in our fields. And when we get to have this relationship with the doctor and the patient where we're really growing and being enhanced, it's really a lot of fun. And it starts to open up our eyes to more comprehensive care for our patients, which is there's better conversations. There's less monotony. It's just, it's a totally different day in the operatory.
Yeah, I sense from a lot of hygienists, if there is burnout, that it could be because they need to be reinvigorated by either continuing education or someone who can come in and bring different ideas, or that I'll put it to you and I'll kind of like reverse engineer it. I find that when I go and do those things to learn and to bring it back into my practice, and that I am having those conversations with the patients that light me up about the things that I love to do and make a difference with the patient, that I love working. I love touching patients' lives, but I think that's true with any of us. So I sort of see burnout as an opportunity to look at ourselves to say, what can I change? Because ultimately it starts with us and the choices that we're making.
Yeah, it really does. And having a coach talk to you and work with you and shadow you and see you, they will see things in you that you don't see in yourself.
Yes.
And it's their job to pull those things out and to accentuate them and to help them develop. And after 10 years as a hygienist, I certainly knew how to deliver hygiene care and make a next recare appointment. But I didn't understand that my approach could use some fine tuning, and my ability to have more confidence in myself created my the way that I delivered information to patients come out in a completely different way. It was far more authentic and far more effortless when I really started to gain confidence and believe in what I do as a hygienist.
Yes. And, kind of wrap it all together in a bow too. I think that a lot of hygienists and the team that a consultant could be perceived as a threat to them.
Yes.
Right. And what I really want to tell you guys is that from a consultant's point of view,
Mm-hmm.
I would change my perspective to say that this office cared enough about me to invest in me,
Mm-hmm.
to hire someone. So think of them as your coach to bounce ideas off of, because that's where it usually, once everyone's guard goes down, like you feel like you can
It
hear the
does.
wall coming down,
Yeah.
right?
Yeah.
Once you hear it coming down, then they go, okay, so I've got a question for you.
Yes. Yeah. And then all of a sudden they're like, actually, this is kind of great because I've been really wondering about this and I don't know what to do. And now I have
Yeah,
somebody to ask. Yes. And as hygienists, we've done the job. We have done their job. So I find that's more friendly because it's like, okay, you're someone that has rolled up your sleeves and you have done this. You know what it's like. You've been in my shoes and you're here for me. You are here. You are for me. You're not against me. And you're not here to make my life harder, to make my career shorter. You are here to empower me. And yes, the doctor is hiring a coach not because you're not doing a good job. The doctor is hiring a coach because they see you in a way that is worth investing in.
absolutely. Absolutely. And what if in any area of your life, Erika, that you could have, all right, hear me out, hold space. If you could have someone say, hey, Erika, what if I could make your life better, make your life more meaningful, and give you time back where you're in flow? I would be like, heck yeah, sign me up for that. I
Yeah.
mean,
What's it
where's
going to
my
take?
person? Bippity boppity boo, right?
Right.
And it's not a coach isn't about, oh my gosh, I'm watching my clock to see if that takes you that amount of time to
Mm-hmm.
do something. I'm not timing you.
Mm-hmm.
There are some times where hygienists will say, Kelly, can you time me for
Mm-hmm.
something? Because I want to know how long it takes me to do a certain procedure. And I'm like, absolutely. Or if we're
Sure.
working on it's a tool that we use for them. But usually I'm like, hey, what do you
Right.
think about let's try this to
Mm-hmm.
do this? And they're always involved in it. You?
Right. But you're using that clock to uplift. You're not using that clock to punish. There's a
Yes.
difference.
Yes.
And yeah, and it's like, well, I can't stay on time. What am I going to do? And instead of, well, you just got to stay on time. It's like, no, I have really great strategies for you, and they work. And if you hear me out and we practice them and we role play them, it's going to be fun because this thing that you're dealing with, the hygienist is dealing with day in and day out, that is a stressor, is going to go away. And everybody's going to notice in the office too. And it's really fun when the person being coached starts to get congratulated by the people on their team. Like, we know this has been tough for you. And we
Mhm.
see you growing and shining and taking control of that issue. And that is such a confidence builder, and not to mention just makes the day as a hygienist a lot less stressful.
Yeah, it's I can't tell you the happy tears that I've seen,
Mm-hmm.
right? And just the happy tears of I can't imagine what it was like before we did this, and my job is just so much more enjoyable now. I feel like I feel revitalized by it. I feel renewed by it, and I'm having different conversations, and the conversations are meaningful. And think about, you guys, how not just how that affects your patient and how they can sense that from you, but now you get to take that higher level vibration back to your family and your
Mm-hmm.
friends, and the difference that you're making in the world just by doing
Right.
what you love to do and reimagining that.
Yeah. Well, and it's something where I don't know how have you handled it when you are faced with a person that is fearful and is but it's coming across as hostile when someone has been
Mm.
told, hey, we've hired this person, they're going to come in and they're going to work with you. Kelly, how have you found that it works to diffuse that situation?
Well, I find there's usually several hygienists that I'm working with.
Mhm.
So, like you, it's observing, it's team building. I'm helping them turn over rooms always because I just feel to get your gloves in it and to be
Right.
part of the flow. I'm perio charting all those
And you
things.
know
So
what you're doing. They're not like, no, don't touch that. You know, you know what you're doing.
yeah, I mean,
Yeah.
mostly unless, I'm putting in numbers from a computer system I haven't seen yet. But I'm like, okay, how is
And they're
this?
like,
But
actually, we could do this by ourselves. Thanks, Kelly.
they probably could say that, but it just takes a minute. It just takes a hot
Yeah.
second. But
No, but it shows your willingness to get in there with them and like
yeah,
you're in it with them. Yeah.
absolutely. And so by building that and that peer-to-peer relationship, I think
Mhm.
no matter what, it's when someone is in that mode, if they feel it could be a level of threat, fear, anxiety because they don't know why you're there. And so if I
Mhm.
can build that understanding through conversation and just say, what's the one thing that you feel like you always have trouble with time? What do you
Mhm.
never get a chance to get to that you really love to do? And they
Yes.
usually say, it's the usual answer is, I would love to spend more time on oral hygiene instruction, or I would love more time to do this, or to take
Right.
more pictures, or usually it comes down
Right.
to OHI. And it's like, okay, can I help you with that? Because
Mhm.
I'd love to bring that back into your appointment,
Right.
and
Well,
to
and I
see.
love your the point you make about that you're listening to them, you're asking them. That's one of the biggest things we do when we come in is the first thing part of the assessment is just listening. Because we
Mhm.
may have our ideas as a coach about coming in and what we think the office needs and then the trajectory completely changes based on what the doctor is talking to us about, the team members are talking to us about and it's like, "Oh, I actually see where we need to go first." And it doesn't have to be just the doctor bringing in a coach hygienist. You can advocate for yourselves
Mhm.
and say, I want to take our hygiene department from like mediocre to like just excellence. And I think it's going to take bringing a really good person in. Um, and so then they can talk to their doctor, bring it up, advocate for themselves and say, hey, you're going to get returns on this. This is going to only boost your business. And I think that we as maturing hygienists, we really feel like if you brought someone in to work with us, we would take it on and run with it. And I think that it's going to exceed your expectations. As a business owner, I can't imagine the thrill of hearing my team members say that to me. That would be very convincing.
Yeah, because I feel like too, when we're in that role, we're able to, because we are observing from a different lens. Because if some, how often does someone watch every little thing that you do every day and notice
Right.
in a good way of
Mm-hmm.
saying they are busting their hiney? And because
Mm-hmm.
I think human nature is to we always think that we do more than the person next to us. That's just human
Right.
nature. And so for
Yes.
someone to acknowledge that and to actually advocate for you because someone's watching you, watching this go over here, how long you're waiting for exams, how
Oh, no
long,
one waits for exams.
I mean, in Virginia we do. And on the
No,
East
we
Coast we do,
we don't do
Erica.
that here. No, I've never
We don't do it
waited.
on the West Coast. I mean, it's not long. Our doctors are,
Yeah.
our doctors are on time or 2 minutes,
Yes.
2 minute wait. But to say it for me to be able to say, listen, at the end of the day, go to the docs and say, here's some of the opportunities are for the practice
Mhm.
is that there's this, and you peel it apart, you take it apart and say, they're waiting this amount of time once they're calling for a check. And the doctor that it improves their morning huddle, or maybe they didn't have a morning huddle. And how does the
Yes.
doctor know when you're ready? Is it obvious to them? It's the little bitty things that make the
And many,
difference.
many of them. They are. And shadowing is such a vital part of this, where I really get to go in and observe. But I don't know how you handle it, but the thing that I found that I think is very respectful is I shadow in a way that doesn't undermine the hygienist's authority with their patient at that time. I really keep a distance, and I'm just really in the shadows, paying attention to everything. And I even say, hey, you're going to see me in the office. You're going to see me around, and you're going to know that I'm listening. But you know what? This is such a no judgment zone. It is like, I really just want you to be yourself. I think you're amazing. And if you're yourself, then I can really hone in on what would be helpful. And it's not even what I need to correct. It's like, it's really so much about just taking the talent that people have in their practices and just making that exponential. And so it's long gone, or even the way we speak to our patients. Our MO for so long was about the lecture and the judgment. And as coaches, we don't do that either. There's no room for that. It's not effective anyway. So
With
it's
love.
really, yes. So I promise anyone thinking about having someone come in and consult their dental hygiene department, or even the office as a whole, which typically it ends up that way. It is not anything to be worried about. It's only going to produce positive results.
Yeah. And I think something just came to mind too. I think it could trigger something in folks where it feels like your hygiene instructor behind you watching what you're doing.
Oh, none of us have any sort of trauma from that. Yes.
I mean, I know that my students didn't.
Of course not.
Of course,
and I
my
actually
students
believe
didn't.
they did. And I believe that. I do.
With love. But I'm thinking about the neural response, the very fight or flight, and that it's nerve wracking for someone to watch you. But understand too, just to hear this conversation between Erika and I, and just know that perspective from two different people, and she's West Coast, I'm East Coast, that we're handling it the right way. And we're here to support. We're here to support and love on you. That's, I think, at the center of what I know that you do too, Erika. That's what we're here for, and it's about for us.
Absolutely. And bringing up dental hygiene school, I think you hit it on the head. It's like, we all remember that one. There's probably only one for me, but we all remember that one instructor that was the really kind one that you were really hoping you would get when the checks came around. And I have a feeling that you were very kind like that with your students, and are very kind. And it was just, that person oozed confidence and caring, and they really wanted to see people successful. And teaching styles used to be more they would liken hygiene to boot camp. Yeah. And it is effective. I mean, but I don't know what long-term effects it has on a person. But you do learn. But there was that person that really was maybe a little ahead of her time when I was in hygiene school, and she knew that a positive approach and an uplifting approach did get the same, if not better, results out of students. And so that is absolutely, there's no room in effective coaching. There's pushing in a way that's loving and extending comfort zones so that we can really blossom into the purpose for our life, and we can be that little butterfly that comes out of the cocoon that struggled a little bit. And without the struggle, we don't get to be that beautiful butterfly. So to have a consultant and come in and coach you and really see the things in you that are ready to blossom, it's such a positive experience, and it's nothing to fear.
Yeah, it's a gift. I truly think it's a gift. If you had a person there you said it, to see what was possible in you, because everywhere I think that each of us have been, we can look back and say, and think about the seed that was planted in us, where somebody saw something in us, and that encouragement and that support is what made the difference in our lives and who we are today.
Yes, absolutely. And then it is, and you speak of a gift, it's a gift back to the teacher or the coach or the program director or the consultant, or even to the doctor when we think that we're training and giving, and then you realize, wow, I'm receiving something back. And I didn't even go into this for any sort of selfish reason. Of course, it's to give and to coach and to uplift, and then we're receiving too. I mean, how cool is that? Because when people come back to you and say, this made such a difference for me, or this really helped me, you gave me such a gift. Yeah, and it's like, no, you gave me a gift. It's changing lives, and it is such a thing that is helping me be that butterfly too.
Yeah. Thank you, Erika. It's always a pleasure. Hopefully you guys got some good nuggets out of this and get some feel good and some encouragement from us. And you guys know how to get in touch with Erika. She's in the show notes and you'll see more of her. Erika, thank you.
Thank you, Dr. Tanner. It's always a pleasure.
Love you, love you, love you. All right, friends. Thank you for being here on the Dental Handoff. Give us a 5-star rating on Apple Podcasts. Go on over to YouTube, like, subscribe, share. If you hit that like button, it lets other people know that they would like us too. So thanks for everything that you do every day. We will see you soon.
Okay.
See you later, friends.
Bye.